The arterial baroreflex is a negative feedback control system that regulates blood pressure over short periods of time, from seconds to minutes. So if we look more closely at how the sympathetic and parasympathetic nervous systems influence the function of the heart or the vascular smooth muscle in order to maintain a mean arterial pressure within that set point range. So first, if we look at this central equation here, the mean arterial pressure is equal to the product of the cardiac output and the systemic vascular resistance. So an increase in cardiac output or an increase in systemic vascular resistance would lead to an increase in mean arterial pressure, just like a decrease in either cardiac output or systemic vascular resistance would cause a decrease in mean arterial pressure. So the whole point of the baroreflex is to regulate the cardiac output and the systemic vascular resistance to keep the mean arterial pressure right around the set point. Also, remember that cardiac output is dependent upon the heart rate and the stroke volume, and increases in either one of these factors would cause an increase in cardiac output and ultimately an increase in mean arterial pressure. Let's also remind ourselves that stroke volume is dependent upon contractility of the heart muscle, the preload, and the afterload. So contractility and preload both positively regulate the stroke volume, and increases in either one of these factors would also increase the stroke volume. Afterload, on the other hand, is a negative regulator of stroke volume, and an increase in afterload would decrease the stroke volume. So if we focus first on the parasympathetic nervous system, the parasympathetic nervous system acts solely on the heart rate, and it negatively affects the heart rate. So any stimulation of the parasympathetic nervous system results in a decrease in heart rate, resulting in a decrease in cardiac output, and ultimately a decrease in the mean arterial pressure. The sympathetic nervous system acts on many different tissues, as you can see from all of these arrows surrounding it. Like the parasympathetic nervous system, the sympathetic nervous system also acts on the nodal tissue, but sympathetic stimulation, on the other hand, increases heart rate, which increases cardiac output and therefore increases mean arterial pressure. The sympathetic nervous system also acts on the heart muscle itself, causing an increase in contractility, which positively regulates stroke volume, causing increased cardiac output and ultimately mean arterial pressure. The sympathetic nervous system also acts on the smooth muscle of the veins, decreasing their compliance, ultimately resulting in an increase in venous return and an increase in the central venous pressure. And because preload is dependent upon this central venous pressure, when central venous pressure increases, preload also increases. The sympathetic nervous system also acts directly on the arterial smooth muscle, causing constriction, resulting in an increase in the systemic vascular resistance. And that increase in systemic vascular resistance directly causes an increase in mean arterial pressure. The sympathetic nervous system can also stimulate the release of hormonal components of this pathway, like angiotensin II and vasopressin, also known as antidiuretic hormone. And these two hormones act to increase the blood volume, as well as increasing the thirst and salt appetite, which increases the venous return and the central venous pressure, and as we saw, ultimately increases the cardiac output. Angiotensin II and vasopressin can also decrease venous compliance, again leading to this increase in venous return and central venous pressure, and ultimately an increase in cardiac output. So now let's take all of this regulation and look at a couple of examples to see how it all fits together. So the nerves are firing action potentials to the central nervous system at a rate that's proportional to the mean arterial pressure. So the higher the mean arterial pressure, the higher the firing rate of those baroreceptors. Likewise, a decrease in pressure leads to a decrease in firing rate. So there's this relationship between the mean arterial pressure and how fast the baroreceptors are firing. And normally, the baroreceptors fire at a certain rate or frequency to signify that the mean arterial pressure is right at its set point of around 100 millimeters of mercury. And the operating range is around a range of 50 to 200 millimeters of mercury. So if the mean arterial pressure increases, the baroreceptors increase their firing rate, and this increase in firing rate leads to a relative withdrawal of sympathetic nervous system activity and a relative engagement of parasympathetic nervous activity. So the decreased sympathetic tone ultimately leads to a decrease in cardiac output and a decrease in systemic vascular resistance. And the increased parasympathetic tone causes a decrease in heart rate. On the other hand, a fall in the mean arterial pressure from that normal set point causes a reduction in the firing rate of the baroreceptor. And this leads to an increase in the tone of the sympathetic nervous system and a decreased influence of the parasympathetic nervous system. So this engagement of the sympathetic nervous system leads to an increased cardiac output and systemic vascular resistance, ultimately leading to an increase in mean arterial pressure. And the withdrawal of the parasympathetic nervous system actively leads to an increase in heart rate, which also ultimately leads to an increase in mean arterial pressure. So to summarize, if we have an increase in the mean arterial pressure away from the set point, this leads to an increase in the firing rate of the baroreceptors, a decrease in the sympathetic nervous system activity, which causes a decrease in cardiac output and systemic vascular resistance, which then restores that mean arterial pressure back down towards its resting level. And if there is a decrease in mean arterial pressure from the set point, that leads to a decrease in the firing rate of the baroreceptors, an increase in the sympathetic nervous system stimulation, which leads to an increase in the cardiac output and systemic vascular resistance, and ultimately an increase in the mean arterial pressure, restoring that set point. So one thing that's important to note is that there's always some basal activity of both the sympathetic and parasympathetic nervous systems. And this baroreceptor reflex and firing frequency is really just regulating the balance between the two. So with a higher blood pressure, you're going to have more parasympathetic nervous system activity, while with a lower blood pressure, you're going to have more sympathetic nervous system activity. Let's look at this example of how the baroreflex works. And one of the most important functions of the baroreceptor is maintaining the mean arterial pressure when we stand up. So when we stand up, there's a decrease in the venous return as blood's pulled down to our legs and feet due to gravity. And as a result, there's a decrease in venous pressure. This leads to a decrease in the atrial pressure or preload, a decrease in the ventricular end diastolic volume, another measure of preload, and ultimately a decrease in stroke volume as a result of the Frank-Starling mechanism. A decrease in stroke volume leads to a decrease in cardiac output, and decreased cardiac output causes a decrease in the mean arterial pressure. And remember, that's because the mean arterial pressure is a product of cardiac output along with systemic vascular resistance. And this process happens to all of us to some extent when we stand up. There's a fall in mean arterial pressure, which is why you might feel a little lightheaded right after you stand up. But the reason that lightheaded feeling goes away so quickly normally is because the arterial baroreflex engages and corrects the mean arterial pressure back up to the normal range. So with this decrease in mean arterial pressure, normally the aortic and carotid baroreceptors decrease their firing rate, and this is where that baroreflex kicks in. So this is an overview of that reflex response that happens to correct that drop in mean arterial pressure that happens when we stand up. So that way, if you do happen to get a little lightheaded, it's quickly corrected and doesn't last long. So we said that that fall in mean arterial pressure reduces the stretch on the baroreceptors, and that decreased stretch causes a decrease in the firing rate of the baroreceptors. So there's a decreased rate of impulse production of these baroreceptors. This decrease in the afferent neural traffic from these structures decreases the neural input and output from the nucleus of the solitary tract, or that NTS in the brainstem, which causes increased neural activity in the sympathetic fibers, increasing sympathetic efferent activity to the blood vessels and to the heart, with the final goal of bringing that mean arterial pressure back up to the set point. So this sympathetic efferent activity increase has a few important effects. One, it causes constriction of the systemic arterioles, and constriction of the systemic arterioles ultimately leads to an increase in total peripheral resistance, or the systemic vascular resistance. Sympathetic activity to the heart increases heart rate by acting on the SA node, and it also increases contractility of the ventricular muscle. Increased sympathetic activity also causes constriction of systemic veins, which increases central venous pressure, causing increased venous return to the heart and resulting in an increase in the ventricular end diastolic volume, or increased preload. An increased preload, along with this increase in contractility, ultimately leads to an increase in stroke volume. And with an increase in stroke volume and an increase in heart rate, there will be a greater cardiac output. And that increased cardiac output, combined with the increased systemic vascular resistance resulting from the arteriolar constriction, ultimately leads to a restoration of the mean arterial pressure.